Good morning everyone. I am Ummehni, a second MBBS student from KRIMS Karwar. Today I will be presenting a seminar on three topics that are tuberculous lymph node, leiomyoma of uterus and atherosclerosis. We will look at their introduction, gross features, microscopic findings and key degenerative changes, particularly focusing on hyaline change. The first topic is tuberculous lymphadenitis. Tuberculous lymphadenitis is the most common form of extrapulmonary tuberculosis. It predominantly affects the cervical lymph nodes. Grossly, it shows enlargement of lymph nodes and which are mated together due to periadenitis, that is inflammation of surrounding connective tissue causing them to stick. Cut surface shows yellow white cheesy material known as caseous necrosis. In advanced and healed lesions may show fibrosis and calcification. Under the microscope, we look for classical tuberculous granuloma containing a central zone of caseous necrosis, which is amorphous granular eosinophilic debris. Epithelial cells surrounding the necrosis are modified macrophages known as epithelial cells, characterized by abundant cytoplasm and pale staining slipper-shaped nuclei. Langhans giant cells. These are distinctive multinucleated giant cells with nuclei arranged in a horseshoe or wreath-like pattern at the periphery. Lymphocytic collar. A dense ring or collar of lymphocytes encloses these epithelial cells aggregates. Next, hyaline change. In older or healed lesions, the granulomatous tissue is replaced by dense eosinophilic hyalinized fibrous tissue, which serves as a key indicator of chronicity and healing. The key important points include caesacean granuloma is the hallmark lesion, Langhans giant cells are the characteristic feature, fibrosis, calcification and hyaline change occur in healed lesions. Moving to our next topic, that is leiomyoma of uterus. In this we will discuss gross morphology, microscopy and hyaline change of leiomyoma of uterus. It is a benign tumor of smooth muscle arising directly from the myometrium. Importantly, it is the most common benign tumor of the female genital tract. Grossly, it represents as well circumscribed, firm, grounded tumor which are white-grey in color, which shows characteristic hole appearance on cut section. They may be single or multiple. It involves common sites like intramural, submucosal and subserosal. Intramural include within the muscle wall. Submucosal beneath the endometrium or subserosal, that is beneath the serosa. Microscopy shows interlacing fascicles of smooth muscle cells which are uniform spindle shaped smooth muscle cells. Nuclei. The nuclei are elongated with blunt ends, often described as cigar shaped nuclei. Benign nature. There is minimal cellular atypia and mitotic figures are rare or completely absent. Hyaline change. This is the most common degenerative change in leiomyomas. It occurs due to an inadequate blood supply as the tumor outgrows its vascularity. The smooth muscle cells are progressively replaced by a homogeneous structureless eosinophilic hyaline material. This change is seen in roughly 40 to 60% of the cases. The other degenerative changes includes cystic degeneration, mixed edema degeneration, calcification and red degeneration, especially seen during pregnancy due to acute hemorrhagic infarction. Key points are the leiomyoma of uterus or uterine fibroid is a benign smooth muscle tumor. Grossly, it shows hole appearance. Microscopically, spindle cells with cigar-shaped nucleus are seen. Hyaline degeneration is the most common secondary change. Moving to our last topic, that is atherosclerosis. Atherosclerosis is a chronic inflammatory disease of medium and large size arteries characterized by formation of atheromatous plaques in the intima layer. Grossly, it begins as flat yellow fatty streaks which progress into raised yellow white intimal plaques that are nothing but atheromas. Distribution is it most commonly impacts the aorta, coronary arteries and cerebral arteries, and complications include these plaques progressively narrow the vessel lumen, reducing blood flow. In advanced lesions are prone to dangerous complications such as calcification, ulceration, plaque rupture and thrombosis. Microscopy shows a classical plaque consists of superficial fibrous cap and a necrotic lipid core containing cholesterol clades, foam cells and a cellular debris. Hyaline atherosclerosis, often accompanying atherosclerosis, particularly in patients with systemic hypertension and diabetes mellitus, is a hyaline change in smaller vessels. Here, a pink, homogeneous, eosinophilic hyaline material is deposited inside arteriolar walls, causing marked thickening of vessel wall and narrowing of lumen. Grossly yellow raised atheromatous plaques and microscopically shows fibrous cap and a lipid core. Hyaline atherosclerosis shows pink homogeneous thickening of vessel wall. Thank you.